One of the things before I log off, I wanted to include in this is hormones. So cortisol is the father hormone of other hormones. And that is super important to remember here. But in the perimenopause and the menopausal woman, this is where I see a lot of, the interaction between your sex hormones, progesterone and estrogen. I've seen stress, emotional stress, physiological stress, put a patient or woman into menopause. And what happens in these circumstances is that the cortisol goes up, your body, your hormones are a symphony. Everyone is playing a part. And unfortunately, usually estrogen, which protects us, can be depleted pretty quickly. What I see in menopausal women with excessive stress is that the cortisol goes up, the estrogen gets depleted, and then they become more androgen dominant. Okay. And as we know in hair, that causes a lot of female pattern hair loss and shedding. And I feel that stress in that woman going through menopause, which is stressful enough, we can see the changes that are occurring. And I feel that that's super important for a woman to remember is that stress, when your hormones are already stressed, it can create a lot of dyssynchrony in your body. And I think that that's important to note. Not only physiological stress, but definitely emotional stress. And those are the important things to kind of be aware of when we're going through those times in our life when it's very stressful. I think being a woman now, you've taken care of your parents, you're taking care of your kids. We're working multiple jobs, and all of this is stress, chronic stress, and our hormones definitely play a role. And I see it every day in a lot of patients when I'm reviewing their hormonal panels. And I think that we have to look at that as a part of our hair loss.
Thank you, Kim. I think that's actually an excellent point, and one that I actually didn't give a lot of consideration to. But that is an incredible amount of emotional stress for a lot of women. And it does play a huge role in androgenic alopecia, which we didn't spend a lot of time on. But there is a lot of scientific research to support that increased emotional stress, increased cortisol will accelerate androgenic, just what most people think about as being female pattern hair loss. And we do know it accelerates around the perimenopausal time. So not only the hormonal physiologic stress, but the emotional stress that goes along. And so I want to sort of move on to, what can we do to help modify some of this stress? Our world is kind of crazy. It's been especially stressful over the last 3 to 4 years. There's a lot going on now, and we all feel it. And so are there things that we can do to try to minimize the effects of this stress on our bodies? And, are there benefits to trying these lifestyle changes to reduce stress? And the answer is yes. And there's a fair amount of science to support this. Okay, I have a towel a dish towel in my kitchen, which is hanging on my stove, and literally says, I meditate, I do yoga, I chant, and I still want to smack someone. And the reality is, stress is all around us, but we still have to work at it. And it's not the answer to everything. It needs to be a part of our treatment plan for a lot of these hair loss diseases. So it doesn't mean you don't keep at it. You do have to keep at it. It's something you have to stick with. And there are going to be times when it's going to be hard, but you need to keep at these lifestyle changes. And I'll show you why. These lifestyle changes that we recommend: meditation, yoga, exercise, diet and supplements, sleep, and improving social connections. And I'll talk a bit about all of these. 30 years ago, just here in Massachusetts, Dr. John Kabat-Zinn started the mindfulness-based stress reduction program at UMass Medical School. It was incredibly new. It was an 8 to 10 week program. He utilized yoga and meditation to help patients learn to decrease the stress response in their bodies. Since then, there have been thousands of studies done to show that these techniques help. They improve the outcomes of some of these treatments. They help the treatments work better. And most recently, some of the research is beginning to show how and why these treatments work. I was fortunate enough back in the early 90s to take John's class and to have him as my instructor. And I, wasn't looked highly upon at the time. He was really quite, it was quite a new idea. And I remember one evening we were meditating and a bunch of surgical attendings walked in the door and they wanted to use the room. And, John said, well, we're meditating, and they were very doubtful as to why we were bothering to do it. But since then, fortunately, there's been a lot more acceptance and a lot more research done to show that it's helpful. A large study published in 2017 in the magazine of Frontiers of Human Neuroscience demonstrated that after a 3-month yoga and meditation retreat, the participants had improved levels of anti-inflammatory cytokines. Those are those proteins that can be released during times of stress. So the anti-inflammatory cytokines increased. There was a decrease in the pro-inflammatory proteins, the ones that caused inflammation. The cortisol levels leveled off and became normalized. One new thing that was found was there was an improved levels of a protein that's called BDNF, which stands for brain-derived neurotrophic factor, which, to make a long story short, it's a protein that is actually released in the brain that helps our bodies and our brains adjust to changes in our environment, in our lives, so that during times of stress, that protein gets released to help us adjust. It improves the nerve function. It improves the growth factor activity, which is so important in hair growth. It actually also improves long-term memory. So there's a lot of benefits that were found in this study. Also decreased measurements of anxiety. Well, this is lovely, and it shows that under the most intense 3 months of yoga and meditation, when they were really separated from the world, this is what can happen. Unfortunately, that's not where we all live, but it just proves that with repeated practice, that these things can have a significant benefit. What about exercise? So I want to talk about the benefits of exercise from a cardiovascular standpoint, and that's been shown over and over again. But low levels of exercise have been shown to be related to increased measures of inflammation. So it can, and as well as increased levels of pro-inflammatory cytokines. So low-level exercise, sitting on that couch, not doing anything, is actually aggravating the inflammation in our bodies and can aggravate some of these diseases that we were talking about. Interestingly enough, this same protein, the BDNF protein, was decreased in people who don't exercise very much. So again, that's a protein that is actually needed to help us adjust to change, help us adjust to stress, and those levels decreased when we were inactive. What about diet? Diet is something that I feel very strongly about. And I think it's one of the reasons why our bodies are responding to stress so horribly. And what we're seeing so much in terms of hair loss in our clinics over the last 5 to 10 years. The Western diet is extremely pro-inflammatory. We know it increases the risk of heart disease, cancer, and it increases the risk of autoimmune diseases. It increases oxidative stress, which means that our body cells basically deteriorate and age prematurely. And the diet also activates inflammatory genes. It alters that gut microbiome that Kim had spoken about. It results in a leaky gut, which increases inflammation. Again, also decreases that BDNF protein. So what do I mean by a Western diet? It's a highly processed, high-fat diet with very few fresh fruits and vegetables, a lot of red meat, a lot of fried foods. Those are the diets that are causing inflammation in our bodies. And it's only been getting worse over the last 50 years. I strongly recommend to all of our patients that they try to adhere to an anti-inflammatory diet. There's something called Dr. Wheel. He's actually a physician in Boston. He's very much involved in lifestyle changes and how it improves our health. But we know there's so much inflammation in the hair follicle and so many of these diseases that cause hair loss. And so trying to decrease that inflammation as many ways as possible is incredibly important. What you'll see on this pyramid is there's not a whole lot of meat there. You know, the majority of the diet is vegetables and fruits and beans and legumes. And, you know, you work your way up and you get a little bit of healthy sweets at the top. But in fact, you know, you can, on his diet, you can eat fish and shellfish. The Blue Zone diet, which some of you may have heard about, there's actually a Netflix documentary series on it. These are areas in the world where people live the longest. And most of them are vegetarian. They might have a little meat here or there or a little fresh fish. But it basically is the same anti-inflammatory diet that you see on the left here. And you know, they're researching these individuals who eat this diet and trying to figure out what it is. But the biggest thing that they know is that it decreases the inflammation in the body. So anything that we can do to offset that stress, which we know does increase inflammation, anything we can do to offset that, including exercise, stress reduction, improved diet, all of those things are going to help overall health and improve our hair as well. What about supplements? I will tell you that for many, many years, I rarely encouraged my patients in my medical practice to take supplements, except those people who had been chronically ill, were eating poorly, had lost a lot of weight, recently had surgery or a bad infection. Those people I would encourage them to. But other than that, I never really felt it was that important. But after doing a fair amount of research on this, the Western diet is extremely deficient in nutrients. The foods that are grown in this country, the soil is depleted. There's fewer nutrients, even in the good foods and the fresh fruits and vegetables. There's fewer nutrients in those than there were 50 years ago. During stressful times, we all eat poorly. How many of us, after having a hard, stressful day, put the kids to bed, have a few minutes, head over to the fridge and grab a pint of Ben & Jerry's ice cream? You know, you don't eat regularly. You're not eating as well. So poor nutrition can increase the risk of systemic chronic inflammation. And under stress, we tend to not eat as well. So again, to offset that, you know, I have changed my recommendations in terms of supplements. This one article about chronic inflammation stated that the deficiencies in micronutrients, vitamins, and minerals, particularly omega-3 fatty acids, impact the resolution phase of inflammation, meaning that if our nutrition is poor, we're not getting the nutrients that we need, the inflammation that we have is not going to resolve as quickly. So because there's so much underlying inflammation, a lot of it's stress-related, a lot of autoimmune diseases with hair loss, I do recommend supplements now. We did a study a couple years ago, and these were women with androgenic or female pattern hair loss. We didn't know whether or not they had underlying inflammation. It was really just looking at female pattern hair loss, and they weren't undergoing any treatment. And with taking these supplements, prebiotic powder, the Fortifier, and Revitalizer, which are supplements filled with vitamins, minerals, herbal remedies, prebiotics with a lot of anti-inflammatory benefits. After 4 months of just utilizing these supplements, 100% of the participants had an increase in total hair counts. That's remarkable. And the only thing that I can say is that I believe these women had poor nutrition. Probably a lot of them had some underlying stress. We really didn't get into a lot of that, although we did have them do a questionnaire at the end, during the study and at the end. And many of them felt that they felt less anxious, less stressed after taking the supplements for 4 months. Oh, sleep. Sleep is one of my favorite topics of discussion. A lot of women, as they go through menopause in particular, sleep poorly. Poor sleep patterns is almost universally a part of stress. Research has shown that poor sleep is often associated with increased systemic inflammation, higher levels of those circulating pro-inflammatory cytokines. All of those things are going to cause more inflammation. Women generally have a higher response to more stressful situations in their bodies. We unfortunately react to it more than men do. I personally think it's because we're under more stress. You know, as Kim mentioned, we're caretakers. One of the biggest stresses, if you see a list of things that cause a lot of stress, you know, caretaking for elderly parents and families, way high up there. You know, that's who we are. We are caretakers. Women are 41% more likely to experience insomnia, and how the effects this has on our bodies. Sleep is when our body heals. Sleep is when our brain heals. It's when memory becomes a long-term memory. If you don't sleep well, those things are lost. There was a study done at Mount Sinai in New York last year. And so people were saying, well, you know, people who are under a lot of stress, who aren't sleeping well, maybe it's, you know, all these other things that are going on in their body that are causing the cytokines to change. And that was a legitimate question, and the inflammation to be worse. But what this study did is they took 14 individuals who felt that they were not under a lot of stress, that were healthy, and they were sleeping well. They sleep deprived them by 90 minutes every night for 6 weeks. They tested their blood before and after the study. They tested them for immune cells. And what they found was after 6 weeks of less sleep, all of the participants had a significant change in their immune reactions. There were more immune cells, which was a sign of bodily stress. And the biggest surprise was their DNA was altered in these cells. Not only did they have more of them, but the actual genetic makeup of these cells was altered, which is really quite profound and a bit scary. So sleep is important in helping us heal. It's hard to get good sleep when you're stressed. That's where a lot of the other treatments come in as well. Social isolation is known to increase overall mortality from all causes across the board, not just hair issues, not just autoimmune diseases, but all causes across the board. In the last 4 years, we have been more socially isolated than in probably the previous 30 years or so. How this happens is certainly not completely understood, and it's probably due to many factors, but loneliness and social isolation is known to increase those cortisol levels, which we know can compromise the immune system and increase inflammation, and in sensitive individuals aggravate hair thinning.